Nigeria is still among nations carrying a huge burden of tuberculosis, a disease which affects the lungs and gets deadly if not promptly detected for treatment and cure. The federal government, through active partnership, has come up with a new agenda that could change the tide. Senior correspondent Jacqueline Ogo reports.
Nigeria ranks high amongst countries with high burden of tuberculosis. According to UNAIDS statistics, 125,000 persons died of TB in 2021. The federal government does not seem comfortable with these, and in collaboration with the non-government organization Stop TB Partnership Nigeria, the private sector strategy to end tuberculosis in Nigeria has been launched. The Minister of Health and Social Welfare, Professor Muhammad Ali Pate, has invited the private sector to partner with the federal government in raising $25 million for tackling the spread of TB in Nigeria.
We are screening and finding more cases, so the drugs to treat them, in fact, could be a challenge, let's say, from next year, from mid-next year. So we are anticipating that. While federal government will do more in 2025, we're also offering the opportunity for the private sector to also do more.
It's a very good step in the right direction to harness all the expertise from the private sector, their innovations, resources to complement the government's effort to eradicate TB in Nigeria.
Experts say in Nigeria, many people still do not see it as important to test for TB. And when some test, they don't follow up with treatments, which can lead to fatality.
Treatment is free when it's diagnosed. If you come to the facility, treatment is just for 6 months and you'll be okay. That's one. Two, what we could do is that we need a lot of investment, this private sector engagement.
We might need to re-strategize to ensure that we have regular screening of staff.
Key partners like the World Health Organization, the Nigerian Economic Summit Group, and the Dangote Foundation pledged their support, calling for wider cooperation. The federal government wants to use the funds raised to track and treat TB, set up clinics, create awareness, buy equipment and medicines for the detection and treatment of tuberculosis. Jacqueline Ogo, TVC News, Lagos.
While the